Yes. So welcome everybody to another live webinar by I Love Homeopathy. I Love Homeopathy is now an ecosystem to help doctors share knowledge and for doctors to come in, improve on their knowledge on various subjects of homeopathy. And today we have with us Dr. Rajesh Rajendran. He's incidentally my neighbor. He's just he lives in the next street. But I've known him since the time I think Facebook started. He was one of my first Facebook friends and also Google groups. I think if I remember, he was very much into tech from those days itself. Uh, he's an MD in Organon, but his interests lie with homeopathic materia medica. And because of his interest in this, he has now become the co-author of the complete repertory. That's from 2017, right?
Yes, sir.
2017, he's also become the co-author of the complete repertory, which which is a software that I use now after Dr. Rajesh has started. I think we need to come back to that because I've got to ask you how to use it properly. It has amazing information, and I'm sure Dr. Rajesh has really contributed to a lot to that. Without much time, I'd like to hand over this to Dr. Rajesh, and he'll take you through the day's topic. Dr. Rajesh?
Yes, sir. So, good evening, everyone. And the topic I have chosen is progressive degenerative diseases. It's a wide topic as such. There are several diseases that are degenerative, that are progressively degenerative. Some of them they are because of autoimmunity. Some of them are hereditary. Some of them they are caused because of aging process or some mutations, and so on and so forth. We'll just touch a few of them, a couple of them, and probably what remedies could be used in such complaints, both as a constitutional or and as well as for the acute management of such complaints. Uh, First and foremost is like, is it possible to that is also one of the thing. Um, One of the things that we should probably look into. But I'm not going to give a wide range of uh, pathologies or the whatever pathophysiology that is happening around, but rather I would like to present a general overview of it, and then from then carry on further to how we can approach a particular disease or a thing. I hope so. I'm visible to everyone.
Yes, yes, you are. You are.
So I'll just give you some of the ideas about what how this disease can be as a short video sort of thing, and then probable explanation to the approach of the disease as such. So first one that I would like to deal with is Alzheimer's disease. We all obviously know the presentation of it, the causes, and the pathophysiology. You just look at this video as such first, and then we can go into the other parts of it.
What is Alzheimer's disease? Alzheimer's disease is the most common cause of dementia and also the best understood. Alzheimer's disease is thought
We're not
to be
able to see the screen.
deposits.
You're not able to see the screen,
brain.
but just
Not yet.
can you see the screen or not?
No, we're not able to. You need to share content and then
Yeah, I'll just share it. Can you see it now?
Yeah, now we can see it.
So
Yes,
first,
we can see that now, no problem.
first and foremost one is this one, Alzheimer's disease. We'll just have a short intro about it. Please, those whoever are watching, pay some attention to it. The details that are told.
What is Alzheimer's disease? Alzheimer's disease is the most common cause of dementia and also the best understood. Alzheimer's disease is thought to be caused by the formation of abnormal deposits of protein in the brain. These are called plaques and tangles, and they are made up of two key proteins, amyloid and tau. Amyloid and tau are present in healthy brains, but in Alzheimer's. What is Alzheimer's disease? Alzheimer's disease is the most common cause of dementia and also the best understood. Alzheimer's disease is thought to be caused by the formation of abnormal deposits of protein in the brain. These are called plaques and tangles, and they are made up of two key proteins, amyloid and tau. Amyloid and tau are present in healthy brains, but in Alzheimer's disease, they function abnormally. Amyloid forms plaques outside cells, and tau forms tangles inside them. These plaques and tangles damage the nerve cells, causing them to die. When lots of cells die, this causes the brain to shrink. In Alzheimer's disease, the hippocampus is usually one of the first areas of the brain to be affected. The hippocampus has a vital role in forming memories. So someone in the early stages of Alzheimer's disease will often have trouble forming new memories. They may struggle to remember what they have just done or said, and may repeat themselves in conversation. More recent memories are usually lost first, while older memories can remain for much longer. Someone may remember things from their childhood better than they do things from earlier that day, for example. This is because older memories from childhood depend less on the hippocampus and more on other parts of the brain, which are not damaged as early in Alzheimer's disease. In Alzheimer's disease, the amygdala is often affected later than the hippocampus. The amygdala plays an important role in emotion, which explains why a person with Alzheimer's may recall feelings or emotions about an event or person, even if they cannot recall the facts of the situation. As more and more nerve cells die and more areas of the brain are affected, the symptoms of Alzheimer's become worse and more numerous. This is sometimes known as a gradual progression of symptoms. The brain of a person with Alzheimer's disease also has lower levels of a certain. What is Alzheimer's disease? There are many remaining nerve cells, helping to preserve brain function for a while. As Alzheimer's disease progresses, it becomes much harder to remember things. People with the condition can be helped to find new ways to cope with memory loss. There are many simple memory strategies to do this. For example, to remember a PIN number, it may help to imagine the numbers making a shape on the keypad. There are also various memory aids that can help, from simple things such as calendars or sticky notes, to more high-tech solutions such as electronic medication. As Alzheimer's progresses, a person may have less control over their emotions and their ability to express them. It is important to understand this and try to see past how the person is behaving and work out how they are feeling. For example, a person with Alzheimer's disease may follow their carer around because they are in need of reassurance.
So thank you for patiently watching that video as such. Uh, that's just an overview of how presentation of Alzheimer's is as such. So we'll now just look into the possible considerations for treating such a case in terms of homeopathy. So as we studied or as we learned its autoimmune in nature, or it could be for several reasons that could happen as per the English English School of Medicine, or in fact the allopathic school as such, and the changes that are possible. But some of the main things that we need to understand or remember in this is they have mentioned that the memory as such, or the cognitive perception as such, slowly goes down, and the memory for the recent events, they slowly start diminishing, and they remember the past events, and they can recollect those things because of those things already stored in the this one, and recent memory getting affected because hippocampus and all these things are affected as such. And then, so when we correlate it to the current scenario, into the homeopathic perspective, what would be? I think everyone is able to hear me and see me. If so, please
Yes,
mention.
doctor. Yes, we can see. Okay.
So the past, remembering only the past events of life and not too much of the present, gives us two prominent symptoms. That is forgetfulness of the recent things, and then nostalgia. The nostalgia could be anything of from the past. It could be of the good old life, the happiness that they had, or the life they have lived as such. It could be eventful. It could be of several events, being happy, being in misery, being in a sort of struggle, or there are several other things. Nostalgia now need not necessarily mean that it is about only the good things, as the literal meaning goes on, but then those past events. There is some other thing that you can refer for if you are looking into this detail, that is past disagreeable events, if you want to look into. If someone is to look into the nostalgia part, the more pathological part is you can go into this one, past disagreeable events. In the sense, why disagreeable events? Those are the negative symptoms that could actually produce a sort of this more complex. So now you can see there are those dwelling on the past disagreeable events. For example, from the childhood, let us go from the child. There are remedies that are indicated for these past disagreeable events from the childhood as such. Most of them being very new remedies, not so prominent. And then if we go into the generalized ones, we have the other prominent remedies, and there are other sub factors also: frightful, mournful, and then love affairs, or from sexual matters, and so on. So there are also these cross references that you can go into for details, the mortification, all these kinds of details. So that is one place wherein you can actually pay attention to us while treating not just this Alzheimer's, but in various other parts of various other diseases as such, wherein you need to pay attention to what has how a person has evolved from the childhood to the current state, on whatever date, on whichever age he or she comes to you for the purpose of treatment. So what they have gone through, they might already have some predispositions, like for example, hereditary this thing, like what we say, miasm is carried down towards us, and for such degenerative diseases developing within the not for Alzheimer's but the other diseases that we're going to, there is a predisposition already, or this mutations or these degenerative changes happen because of whatever has happened over a period of time in life. Most of the time, not necessarily good things. Either it can be some sort of negative thing that is happening on, or in fact, indulgences also can do, or abuse of medications, abuse of, like, let us say, vaccines. We should not forget the vaccines and all, or abuse of substances. There are other things also that can be abused. Like, for example, something positive. that could also mean it's not helping, that could lead to sort of diseases. Here we can see reading ailments. So reading is obviously good thing, and of course we ask children to read, or it is dealt as a hobby, or any doctor or anybody in in sort of practice of law, a practice of taxation, a practice of medicine that we actually do, or there are other professions wherein constant reading is needed. Some people have the habit of reading novels and so on and so forth. But then even reading could cause so much of degeneration that it could lead to Alzheimer's or any other degenerative diseases. There are several other diseases. But I would just like to focus on this one also. Like reading can also be leading to this excessive reading, being too studious or reading or spending too many hours on reading, or not necessarily perceiving everything, but then like proofreaders are there. Yeah. Though even those people like constantly reading a textbook, the olden days are now the way we expose ourselves to the gadgets, electronic gadgets, whatever. There has to be a moderation that has to be understood. So this sort of causes could be those things that we have to focus. And the other usual things that happen in life that could lead, or what I have actually done here is I have taken this clinical rubric of Alzheimer's disease and those remedies that are indicated during indicated for this condition as such. So here we have 21 remedies as such. What are they? These are the remedies. Most of them are polycress, alum, and the others also of alum. And then we have anacardium, argentum, argentum, nitricum, paredacarb, and we have caladium, coneum, ginkgo biloba, helleborus, hyacinus, maximofleta, thiocinema, interestingly thiocinema, and Whiteinia somnifera. So I would like to mention some of the things over here. Anacardium, I think you all know, the duality of mind is there. They are very they're sort of studious, and then they get the duality of the mind, and they become sort of very selfish in nature, and they also they procrastinate others, and then it's like passive aggressive state that can be seen in anacardium, and also there is a violent state. We also have other violent remedies like Alliurus and Hyosaurus. These people being very violent in their age later on lead into later on to the state of dementia or other things. These are in the sense I don't need to teach you those remedies as such. That's what I think. You all know the materia medica part of it, but these are some of the considerations. Then conium is an interesting remedy. Like we can see here, what our conium covers over here. If you can see, it is covering all the ailments that I have listed upon that could be probable causes to Alzheimer's disease. And some of the important things about conium is that they're very deep, they're intense with thoughts, they're in fact very intellectual. They go into sort of what to say, sort of deep sort of degenerative changes. That's what one might say. Meconium is the poison that was given to Socrates, and it slowly progresses from the lower extremities to the entire body. That's how the description of the death of Socrates is, right? So the in the same way, you have conium patients wherein they are like they are very intellectual, just like Socrates, and they tend to indulge in several things. One of the main indulgences are these sexual indulgences like masturbation, uh, and then substance abuse as such. At a physical level, what this could produce is also atrophy and atrophy of brain, which you can see. Conium has the capability of doing it. And this homesick nostalgia, how is it possible in a conium patient who is very intellectual? When you go back further to their childhood, you can see these things of there is a sort of abuse or sort of indignation or disappointed love from the parents or in the early adulthood with the partners. And then you can also see there is one more important thing, diverse separation from these things. So this goes on for conium. And then we have natrium. these again, Nethermute covers most of these areas. So what I mean to say is there's a particular set of complaints that you can actually first think of based upon the pathology, and then you can build upon it with the peculiarities to pinpoint the remedy. In general, these are the remedies. Opium, I think opium everybody is aware of sort of degeneration that happens, or the sort of mindset that opium has. Hyoscyamus is very classic. Platina, sort of classic human sort of complaints. Cannabis indica, again, is something as they are very accelerated. Then, how should we put? They are so much into thoughts that their mind is so fast that everything else for them seems to be very slow. There is exaggeration of time and distance in cannabis indica because they think so fast, their mind is so active and so fast that they develop they feel that everything is slow because of the fastness of their mind. And you can see they feel like they are in a different sort of world, and they do what to say. They develop several delusions because of this fastness of mind, and they are buried in thoughts, which again leads to absent-mindedness. And they, if you can see the delusions of cannabis indica, they feel as though they are in a heaven. That's the sort of feeling that cannabis indica produce by the abuse, or even those people who are indicated in such state. So whenever the mind is too much activated, such complaints of Alzheimer's can happen. I'll just show you some of the delusions or the state of cannabis indica. They're always absorbed in thoughts, abstraction of mind is there, all these things are there. They're absorbed in their fancies as such, all those things are there. Along with that, you can see exaggeration of distance. You can see here all the exaggerations as such. Things are enlarged, and their distance, things seem to be distant, and exaggeration and inaccuracies are seen. Same way, time also, if you can see. For them, time is exaggerated, and there is lots of confusion because of this, and time passes too slowly for them, appearing longer because actually they're very, very active, and their thoughts are fast. Their memory is very active, and they do things very fast, and they are in a sort of accelerative state. These excitations could lead to complaints such as Alzheimer's. So this is what I would like to mention. And then, if you have observed, if you have listened to the video, there was one particular thing that they mentioned at the end of the video. That these people, they look forward, they look upon the caregivers very much. Like, that is the when they are in a state of dementia and with lessened perception, they look. That's what is mentioned, and this could be considered as clinging. Clinging need not necessarily be considered in children. The one thing that we look for clinging is usually in children or adolescents, or maybe teenagers. But then in old age also, there can be clinging, and that clinging could be sort of in a very polite manner or in a submissive manner. Some of them would be very abusive also, even in such state of diminished abilities because of the bitterness that they have already carried out, because of the manipulativeness that they have. That is one more thing. These people might develop some sort of acute exacerbations. So, what remedies could help them at those periods, along with this dementia, is remedies like Naxwamika could help, Hyoscyamus could help, Pulsatilla to an extent when there is sadness, and a classical picture of Pulsatilla as such. Belladonna, when there is violence, also some sort of violence in the physical complaints, redness of the face, and all those classical features that you can observe. So, if you have a ground plan, or if you have an overview of these things, these top 20 remedies are some of them that you have to concentrate on. And my intention is like just give you an idea of how work out a case, how to have an approach to such disease. Often we are bothered about the diagnostic term, and because of the name itself, we feel how could we deal. To my understanding and to whatever I have seen in the practice is that is only those commonly indicated remedies, usually indicated remedies that are helpful in treating such diseases. And the other point that I would like to mention about such disease like Alzheimer's is that when people are very elated, very enthusiastic, full of energy, investing too much into indulgences, which may not necessarily be abuse. But then those things that are necessary for life, reading or business ailments, can also you can take. That is related to ambition, also courtship related thing, that is love and affection. You can see diverse ailments come. Almost every remedy that is indicated for Alzheimer's also has this diverse ailments come. Then there are other things also, like death ailments from loved ones, for partner and wife. These remedies again and again have this. So while people invest themselves in life, when there is when they're indulged too much, when they're too emotional, when they're too sensitive, such things can happen to them. So if you tend to see or identify such constitutions, you can obviously treat them much prior to such degenerative changes happening to them, wherein it is irreversible. So that's one thing. That's about Alzheimer's. So let's go into the other. Let's go into the next topic. Cystic fibrosis is another condition. That could be of a progressive degenerative disease. And what happens here is it produces excessive mucus, which results in the initially thin, slippery secretions. But then later on, which is also because of the defective gene or the mutation that happens in the person, secretions become sticky and thick. And instead of acting as lubricants or facilitating, like for example, in the respiratory tract for the gaseous exchange, they hinder the production of it, and the ducts and air passages they get obstructed, or even the ducts of pancreas or the common bile duct, all those things can get obstructed. What happens here is that the lung cells, the cell membrane that is present in the lung cells, lung alveoli, they have certain these are ciliary bodies, and they help in the drainage of the mucus in the lungs. And this equilibrium of retaining or the secretion of these lubricants or mucus is maintained because of the chlorine ions. What happens in cystic fibrosis is there is a gene that facilitates this. That gene getting mutated doesn't allow the excretion of the mucus, chlorine ions from that of the cell, thus producing lots of mucus and are getting accumulated. Wherein the ciliary bodies in the lungs, they are unable to expel it or push it out, and it creates an environment where a lot of mucus gets accumulated, thus giving way for bacterial growth or any other pathogenic growth that can happen in lungs, which leads to certain set of complaints. That is insofar as this is concerned, what to say, respiratory disease is concerned. It will also produce symptoms related to that of digestive system. We'll see that. I have a short video, maybe not too much of length. Just have a watch of it.
A patient with cystic fibrosis is susceptible to infections of the lungs. This is due to a mutation that affects a protein on the surface of lung cells. Many different mutations can cause cystic fibrosis, but all of them involve a transmembrane protein called CFTR that functions as a channel for chloride to move in and out of cells. In this case, CFTR is less able to transfer chloride ions out of the cell compared to the functioning protein in people without cystic fibrosis. The channel is, in effect, locked shut. This inability to transfer chloride ions has an effect on the outside of the cell. In people without cystic fibrosis, there is a balance of chloride ions inside and outside lung cells, which maintains the right amount of water and salt ions in the mucus lining the airways. Cilia normally sweep the watery mucus from the lung lining, keeping the surface clean. In patients with cystic fibrosis, chloride ions concentrate inside cells and draw in water by osmosis. With less water, the mucus becomes thicker and cilia can't move. Flow is reduced, providing an environment for bacterial infection. But there are now drugs that can help patients. To find a drug, researchers tested over 200,000 small molecules to see if any
So let's not go into the allopathic part of treatment. We'll look into the probable considerations with regards to the toxicity hypothesis. While discussing Alzheimer's, I was mostly concentrating on the what to say mental things, things related to the mind as such. So here now we shall see things related to that of physical aspects. Since in cystic fibrosis, what happens is the obstruction of the airway passages and the wherever tubular structures are present in the digestive system, and what are the possible symptoms that it could produce, and the resultant pathology that could be, and what are those remedies that could be indicated. Unlike those remedies that were indicated in Alzheimer's, now we can see there are lots of minerals. We can see calcarea carb is there. We see sulfur, arsenic, silicia, phosphorus, natrium. So I think some of the people follow these schools of kingdoms and family and all. So the people can analyze it according to their own perception. What I would like to emphasize is these. One way of approaching is through the mental symptoms. There is other way that could also help us in finding a disability. That is only focusing upon these physical symptoms and then correlating to whatever is present in the past history or the how the disease evolved along with the mentals. Here again, what could be the cause? Since you have to consider that the inheritance is bad, because of which such a condition has developed, which is progressive debility. Some of the complaints initially are manageable, but later on it gets into sort of unmanageable. So, so when there is an obstruction of airway from the upper respiratory tract, that is from nose to the deep to the other parts like throat, larynx, bronchi, and all, the typical things that are produced is shortness of breath, exertion, and obstruction, air hunger sort of things, wheezing, inflammation, this decreased abilities. This could also result in a lot of sensations or lot of perception, delusions as such, because of this decreased capacity of being able to breathe. For example, oppression on the chest, or as in Tuja, the remedy Tuja, you have a complaint that if you, as though someone is sitting on the chest, 50 kilogram of weight is put. That is how they feel when they get these attacks of respiratory complaints. Although Tuja is not really indicated over here on top level, but then you can see here. So, like we again have lachesis. When lachesis, there is a constriction around the chest, constriction around the abdomen, and all those constrictive feelings are there. These are certain sensations produced because of the insufficiency as such. But then in cystic fibrosis, it's not just about respiratory complaints; it also affects the digestive system, wherein it could there could be broad obstruction of the bowels as such, that is the large and small intestines, or anything, or the bile duct or pancreatic duct, thus reducing the absorption of the nutrients, which could lead into development of emaciation as such. For example, we have this. That's why we have to consider this emaciation with good appetite. What is happening is because of the impaired secretion of excessive secretion of mucus, which is obstructing the gastrointestinal tract, wherein those enzymes that are needed for the absorption are not really employ into their action. And this leads into several things. And some of the manifestations that we get due to this obstruction is offensive stool, and then greasy stool. This is general one, but if you how to differentiate or how to individualize this, let's just go for offensive stool itself. You can see there are several subheadings to it, or what could be the other things that can be related things. There is one thing here: offensive constipation. These people with the cystic fibrosis could also present with chronic constipation. Like everything is obstruction. That's what is primary about this thing. So you can think of guacam or calcaria carb, or there are other things, other possibilities that you could look for. Offensive need not necessarily only mean offensive. It could be cadaverous odor, or it could be we'll go for some other cross references. So then you get an idea of what to look in, whatever is disagreeable from one thing. This most general thing to particular you can go about. Same way, what else is there? Because of this obstruction and then straining and constipation, they also develop hemorrhoids, like I said. But with every sort of hemorrhoid, we have several sort of sensation, like sticks, nasiculus, like as the grapes, in allosecotrina sort of things. And there is profuse bleeding, some of the remedies like calcarea, nitric acid, so on, supraphite, and so on. Falsity. Nitric acid is an interesting remedy wherein there is like the hatred that they present. In the sense they are so weak that they cannot forgive others, or they have develop a hatred even when the other person is asking for forgiveness. This is the rigidity of them, the sort of obstructive nature they have uh, results. That's what I could say about it. So we can individualize remedies based on it. Of course, we need a detailed case taking, and this is very general. Is it how we approach a disease in the sense? This is the ground plan. What you have to look upon is those things that are determinative, like those complete symptoms which have a location, sensation, modality, concomitant, or even side, time, and extension that could actually give you a clear cut idea of it. But then to have an idea to go about, to initially start with. Why I'm saying to initially start with this, for disease like Alzheimer, you won't have enough of history. Even in sort of cystic fibrosis or these complaints, uh, it is not so easy to get into the details of the person. So you can sometimes look into the physical aspects of it, provide some sort of relief, and then get into the details, and then you can either maintain the disease, if lucky, can be cured. That is what I would like to mention here. There are, you can see, bryonia is there as an acute help. Rust of Spargo, which China and all there, even colosynthesis. So these sort of remedies also help in acute management or for the acute exacerbations. Again, as I said in the Alzheimer's part, for any sort of disease, when you're treating homeopathically, pay attention to the predispositions with which a person is born physically. I don't think so. People by birth have something developed personality as such. It is the shaping up happens because of the interaction with the initially with the parents and then later on with the surroundings, people around them, and that's how they shape up. So whatever affects their growth, or whatever positive or negative effects that have been there, or the struggles that they have to go through, that determines a person's progress or whatever it is. The struggle or the distress is what creates all these diseases, right? So pay attention to those causes, which can be in such diseases, it could be considered as maintaining cause or the aggravators that have led to such complaints. So I think we have some more time. I'll, so whatever I have covered over there, the this thing while doing the refertilization, these are those symptoms of cystic fibrosis that like this thick mucus secretion produces these sort of complaints. And it's in the sense this much is enough to understand, and you can go and approach disease in general, and then you can build upon it. You can clearly individual education. Many often think that by the name of the disease itself that we may not be able to do it. First, understand the disease, and then see what are all the indicated remedies, and then see the peculiarities of it, and then see what could cause and the in fact the toxicology of each and every remedy, what it would actually produce in a proved state. Look for those things and employ the remedy. The results are obviously going to be helpful. Calcarea, usually we have a perception that their ways, their or graphitis for that matter, if you can see, if you can remember the previous slide that was shown, these people, they tend to be cold, chilly, costly, all these descriptions of that. But then there are people who are thin, very thin, lose their fat, like as mentioned, emaciation despite good appetite. And the remedy indicated for them is calcarea carb. It is usually seen indicated in such conditions wherein there is what to say, sort of degenerative diseases, or they are going into degeneration. It's like they consume themselves so that they can protect themselves. Because that's what happens. Like what I would say, or I want to convey is there was a patient who was like struggling for life, and he was like in general personality was like he was robust, plump looking, everything. But I never have seen him that way. When he came, he was very thin, and he was like losing lots of hair. There was a profuse bleeding, not just in the anus, but then even sputum had bloody sputum, and skin has become so brittle. And he obviously was diagnosed to be with cystic fibrosis, along with whatever complaints he has. But then Calcare really helped him that way. So don't go by the classical descriptions alone of the drugs, but then look into pathology, what it could do, and then you can obviously still treat the patient. And furthermore, I'll just present this small video of pulmonary hypertension and a little bit of approach towards it.
In this video, I want to talk about pulmonary arterial hypertension. So let's start first by defining what is pulmonary hypertension. Pulmonary hypertension refers to an increased pressure in the pulmonary arteries. Now, if you have increased pressure in the pulmonary arteries, and remember, the pulmonary system is a low pressure system, they can have a lot of different reasons.
The most likely reason is some sort of left heart problem. Can be many, many more reasons why somebody is developing pulmonary hypertension. However, in this video, we're going to focus on a very specific subcategory of pulmonary hypertension, on pulmonary arterial hypertension. And this was also previously known as primary pulmonary hypertension. And this is a disease of the small pulmonary arteries, the small blood vessels right here. So why could you have a problem within the pulmonary artery? So here I've drawn a nice wide open pulmonary artery. You can see here the smooth muscle layer, the collagen fibers around in the endothelial cells. So when we're having a patient with pulmonary arterial hypertension, the pulmonary arteries are narrow, and this could be due to, number one, vasoconstriction. So there might be too many vasoconstrictive mediators around, in contrast to vasodilatory mediators, and or there might be also just arterial remodelings, for example, smooth muscle hyperproliferation. And then in the end, you're going to end up with a more narrow artery. So now what is the consequence when we have a disease and a narrowing in these small pulmonary arteries? The consequence is that we're going to end up with more resistance. We're going to have increased pulmonary vascular resistance. Well, if you have more resistance here, we're going to have a higher pressure in the pulmonary artery. If you have a higher pressure in the pulmonary artery, the right ventricle needs to work much harder because it needs to work against this increased pressure. Now, as a consequence, the right atrium needs to create more pressure also to generate the preload, to create the preload, to have the right ventricle to work. So we have now increased pressure also in the right atrium. Then eventually there's also going to be pressure back up into the body's veins. And the first one is the neck vein. And this is going to be the one that you're going to see distended. And then obviously later you can also see all kinds of peripheral edema. And these are all typical symptoms of right heart failure. And that's normally how a patient presents with pulmonary arterial hypertension. This concludes the video on pulmonary arterial hypertension.
Thanks again for watching. So for disease like pulmonary arterial hypertension, again, what else or what new I could say in the sense? Just look at it. These are the possible symptoms that could be produced because of pulmonary arterial hypertension. That is because of the cardiac insufficiency or the greater resistance that is being that is seen in the arteries, pulmonary arterial vessels. The heart has to perform extra bit. But what happens is that initially there is swelling of the ankles. It slowly leads into the legs and then further progresses to the extent of swelling in the abdomen. So this from below upwards, which is not mentioned here, but then you can obviously consider the symptom of symptoms progressing from below upwards. Along with that, tachycardia, and this tachycardia or insufficiency leading into cyanosis of the lips or in fact the whole body in itself. And then there is a sort of syncope that could happen, sudden loss of breath, or along with that of fainting. Which is, there is a fine line of demarcation between vertigo, syncope, and unconsciousness. But then syncope is associated with both respiratory as well as CNS complaints because of the lower blood supply. So you can think of all here. It is not necessarily because of anemia, but because of the insufficiency or inability of the heart to perform well because of the pulmonary arterial resistance. If you could again see, there are several acute remedies that could come as acute help. Like if it is curable or incurable, manageable or maintainable is secondary. But in every acute scenario, if a person is coming to you with unconsciousness, bluishness of lips, and all other classical symptoms, let us say, who is already diagnosed of pulmonary arterial hypertension, you could obviously take a take the help of these remedies such as again lactasis or let us say even hepacil, prime, carbovegetals, digitalis, and then aconite, of course, apis arnica, and those things. And you can effectively manage the acute attack of it. It's not necessarily that, in the sense, there is a perception that we are able to treat only a certain set of complaints, but then acute management in such cases is very much possible, and it actually gives tremendous results as such. And you can manage such people rather than burdening with hospitalization every now and then. If you could find out what is their constitution, what remedy helps them best as a constitution, that could minimize these attacks. Also, if you could see the remedy relationship and the acute remedy, that is acute presentation in which he or she comes with such a manifestation, and what is the peculiarity in it, you can obviously manage through those one or two remedies each and every time. What are those factors? Is it because of the temperature, or is it because of the climate, or is it because of any other emotional things that is resulting? Or you can obviously look into those things and manage these things. I think we are running out of time, um, but then in any sort of complaints, we should be in a position to divide divide the case into two parts. One is the chronic part, wherein the constitution or the miasmatic remedy, what they call, or whatever name one wants to give, that comes into play. And again, there is a acute part, wherein there has to be management of certain acute manifestations. Like for these conditions, classically among these that I have covered, this pulmonary arterial hypertension almost leading to collapse of the person or unconsciousness. We can take note or account of these things. If you can see, there are some interesting remedies here: sarsaparilla, capsicum, um, also apocynon. This is apocynon digitalis, opium, and all are usually indicated. This. Then chelidonium, again, we consider it as a liver remedy, but you can see it is also helpful for these complaints, for such deep pathology. And if you notice, I have considered bad inheritance also in this scenario. As such. Before signing off, I would like to show some other things for dealing with such kind of. These are some of the things that you need to look into repertory, which could help you for the treatment of these progressive diseases. If you're not aware, these things are available. For multiple sclerosis, we have some amount of cases wherein there was a cure or a palliation. That's why multiple sclerosis is listed here. We also have autoimmune diseases. We also fatty degenerative is one possibility. All the degenerations, whichever is there, have a look at it and see whichever is it. What happens with many enthusiasts and young homeopaths is that they say every chronic remedy is indicated, but then that is not how homeopathy works. It can be a polyquest, it can have 8,000 symptoms, but then when a patient is coming to you, it is going to be very specific and very unique. Sometimes the pictures are so interwoven that you may be perceiving some other remedy, and his actual the remedy that he might or she might need might be entirely different also. That is because when we don't correlate the evaluation of disease, the cause, the effect that it produced, and then the consequence, what consequence led to those manifestations. If we are not able to correlate it, then it's not going to help in a good way. But in general, if you can see the plumbum, remedies like plumbum, opium are always indicated in these degenerative sort of complaints. And you can also see remedies like digital is coming up again, time and again in these whatever examples I have shown, because they have the acute affinity to these organs. So just having an overview, you can understand those things that are going to help you on acute manifestation, those things that will help you in the long run. And if any one of you or of the doubt that regeneration itself is syphilitic in change, syphilitic in nature, so only syphilitic remedies would be applicable. There are trimiasmatic remedies. Some of the remedies might be perceived as predominantly soric, but they do help in the treatment of the disease, since they are also trimass remedies like calcareous, calicard, even phosphorus for that matter. You can see here calcarea is there, also Merxol, which is a syphilitic remedy. I would like to show one more thing. I have taken this to explain a little bit more into, especially repararization, softening of the spinal cord. If you can see, there are only 10 remedies in it, and I have set a filter to it. But then, what I found out is these 10 remedies have some common things among them. And then there was an interesting finding also. Whoever, whichever drug is indicated for sclerosis of the spinal cord or degeneration, we can assume what happens if the spinal cord is degenerating, like in Brown Sequence syndrome or some other syndrome. There will be paralysis of the lower limbs and all these things. One interesting thing that I found is parasitic infestations. Almost every remedy, almost most of the remedies that are in this indicated for sclerosis of the spinal cord have had parasitic infestations. That is one thing. And the other thing is that, in the sense, we could trace it probably from the beginning itself. Nursing ailments from it's also covered by most of these things. And when I read the case studies of such a disease, this disease was especially spinal sclerosis or whatever conditions in which we see spinal sclerosis. Uh, they have been having troubles from the beginning childhood itself to the late stages of their life. So if you have to see the earlier stages of life, these things are there. Parasitic ailments. Why parasitic ailments is predominantly or mostly seen in the childhood itself. And then if you go to adolescence, this masturbation ailments that's when from it starts. Uh, and then this neglected or rage fury and all comes into the adolescent part. And then later on, a little bit more, when person gets ambitious, this one responsibility illness from. Again, you have reading ailments from. All of the remedies they do cover. And then the later part of life, or from the beginning itself, that people get busy, ambitious, they start taking the responsibilities, and then they have to face either fear, fright, or get indignant and mortify and all those things. There is also one, see if you can see from the childhood, because of the rules that are placed upon a child, they go on to the extent of developing degenerative. Like, of course, it depends upon what sort of parent they are, how much they are forced. But then this also gives you an idea. And there is an interesting one, darkness ailments. This is something that has to be looked in, like for this particular this thing. Like many people, they start liking darkness, and they spend a lot of time in darkness, and they tend to develop a sort of syphilitic state or degenerative state. So these are some of the ways of finding out remedies. What I have actually done is first I took this one, softening of the spinal cord, and then studied these primarily these remedies, and then what are the common, what is most common among all these common causative factors among all these remedies. That is what I have enlisted over it. The same way, what we can do is also study the pathology of the disease and then again come back to the symptomatology here in the material, then add all those things and see if they are all present in these remedies. Since there is so much commonality in these remedies that I have selected, for example, you can see Argentum nitricum covering these very symptoms, and then Medorinum in hypericum. This lateris and the lateris, I think you all know, it has phenyl butyric acid or something. They are classically represented as there is a progressive degeneration wherein it is compared to first the person is two-legged and then they become three-legged, that is having a sort of fracture, and then they crawl with the four limbs. Lateris is nothing but masoor dal or kesar dal, I think, because of which people once it was used as a protein diet, it led to the progressive paralysis of these things. Based on that, also you can go for a prescription. Hyacinth, of course, extracted from hyacinths. These remedies that are on the bottom are more suggestive because of their pathological action or their capability as a raw material to produce particular specific organ specific pathology. There are other other remedies like argentum nitricum, cuprum metallicum, lumber metallicum. Interestingly, the top five remedies have metals in. So these syphilitic remedies tend to produce these degenerative changes. This is how one can study, I think. I have been doing this seminar probably after a long time. If there were any difficulties or if it was not so clear, please pardon. But then this is what I thought of giving as a beginning. I'll give a general overview of how one can go. That's it. If any one of you want to ask any questions, you can ask.
If anybody wants to ask Dr. Rajesh, they can ask. You can unmute yourself and ask as well. There's no problem. Dr. Sabrish? Dr. Sabrish is there. Does anybody else have anything to ask? Have a doubt about how he's repertorized it, or how do you repertorize a condition
Yeah,
like this?
yeah, Rajesh sir.
Yeah,
Yeah, it's me, Kalpana.
yeah. Hello, how are you?
Yeah, so you told me, you told that in progressive degenerative diseases, parasitic infestation you have seen in most of the cases, right?
Not in every case that I have seen, but then in the study itself that was there, and
Okay.
then while taking the history of patients, those whom I have seen, there has been a history of it.
Okay, so how it is related, can you tell me, or how it is helpful?
It's just a correlation, a finding that you can obviously look in for confirmation. It's not necessarily that the parasitic affectation is present as of now when the person has come with the disease itself, but then in the younger stages, this person has had the parasitic infestations. That's a predisposing factor or in the sense, indicative or suggestive that such a change can happen, or it at least helps in the confirmation of the remedy. Obviously, when there is warm parasitic infestations, some of them they are very superficial. They infest the digestive system at the most. But then there are like let us say Tinea solium or Tinea saginata. They can go and invade the lungs. They can invade
Yes,
the brains, producing the degenerative changes, right? So they could trigger this.
yes,
I have seen. I have not treated, but I have seen a person who had almost about 1,000 cysts all over his body in most of them in the blood vessels because of the tinea infection. So Of course, they were removed, but then the person ultimately died because of degeneration of the spinal cord. In the sense, in general, every organ of him was degenerating and progressively deteriorated. Right? So that's what I wanted to emphasize. It's like there are several cases wherein the parasitic infestations might have a role in triggering such a change. That's what I.
Okay. Okay. Can we, one more question? Can we consider, suppose one person who started with a symptom with heart attack, and then gradually he has developed cirrhosis of liver, and then gradually later on he developed this chronic kidney disease. So
Okay.
can we consider it as progressive degenerative disorder or no?
If everything is degenerating, then we should consider it as progressive degenerative disorder.
Okay.
If in this progressive in the sense, you remember one thing, it is not one day, it's not going to happen in a single day, it is going to happen over a period of time, and one after the other getting affected would obviously be considered as a progressive degenerative disease. But then if there
Okay.
is a sudden failure of all those things, once there is a heart attack and then he developing cardiomegaly or other things, and then cirrhosis of liver and other very fast manifestations, I don't think so it is considered as progressive degenerative disease. These diseases usually
Mhm.
that the remedies that are told also are mostly they are very slow. The
Mhm.
pathology develops very slow. It happens over a period of time. Like for example, Alzheimer's patient, the problem is they don't die right at the old age.
Yes.
They're very old.
Yes.
The slow degeneration is there. It doesn't take away the life. It just cripples them. For any other degenerative disease also is the same. It doesn't directly take away the life or not. It slowly cripples the abilities, which can obviously be maintained. So, with the question that with the sequence that you have said, if it is in a very fast progression, I don't think so. It could be considered that way. It could be something else. But if it is slow and gradually progressing and little by little the economy is being consumed, then we can.
Okay. Okay. Thank you.
Yeah, welcome.
Hello, sir.
Yeah, hello.
Uh,
Yes.
Good evening, sir. Yes, sir. I'm Dr. Priyanka. Sir, I liked the webinar a lot. It was very informative,
Yeah,
and the questions were also nice. Sir, I just wanted to know which software you used.
that's
Uh,
complete dynamics.
Complete Dynamics. Sir, please, can you repeat the name of the software? I could not hear.
Complete dynamics. See,
Okay, sir. Thank you, sir.
complete dynamics. Yeah.
Okay, sir. Thank you.
Sir, can I ask one more question, please?
Yeah, sure.
Okay, so generally in Alzheimer's, we repertorize, we give the medicine for few days. We see little bit of same stage, right? But as per my experience, I have not seen any improvement, particularly in Alzheimer's. So, what is your comment on that? Can you tell, or your experience?
It depends upon the pathology, right? Extent of pathology. And
Mhm.
uh, if brain is almost shrunk, you cannot expect miraculous changes. But what could be or what should be the motto of the treatment is that those trivial things that are affecting them very much. Of course, you will not be able to bring back the memory and all. But then there the techniques that are usually there that could help them maintain memory. But then whatever is from the past, like let us say, that's why I emphasized on the ailments from this thing. If at all a person is hurtful, had been hurt, and still retains those past disagreeable things, one has to get rid of those things, right? It is a obvious suffering that is being inside and has been left. So, despite the fact that they have impaired memory, they still retain those past ones, those early parts of life. The video that I showed is the reason why I showed is obviously because they recollect whatever has happened in the childhood. It could be good memories or it could be disappointing ones or bad ones also. So to get rid of those unnecessary things and having a peaceful life is one of the mottos of treatment. And also, along with Alzheimer's, if there is sort of, let us say, trembling is there, or their physical capacity is deteriorating, that could we could improve them with the Although whether we're going to cure them or not is a secondary thing. But we can stop the progress of the disease. That is one thing. The other thing is that whatever other things are there, like that's what, as I mentioned, any regrets or even anxieties, like as I said, they will be clinging to the caregiver. Why? Because they see only them as the hope. So some of them, they would be in a piteous situation or very pitiful and be almost go on to the extreme of literally begging to be there around. Or some people would be very abusive. Let us say some of the abusive remedies are there. They could, in that stage of this thing, ability, they could still be aggressive and they can have rage fear. If you check with the remedies that I have mentioned, there can be rage. Like recently, someone asked me that what could be the remedy for night watch. The parent is very old, but then very always abusive and have because of her, the person has to be 24 hours away, even in the night. So the people in old age could be quite a burden. Also. So if they have sort of peace inside, they could be calmed down. It's obviously helpful, right? So that can be the motive. A patient or our patient relatives might come with any sort of expectation. But whatever could be done according to the physicians. So that way, it is, yeah.
Okay, but what about this senile tremors which they get? Because I did not see any improvement at all. Whatever medicines we have given for that, it can just stay in that stage, but it has not improved. Even after some stage, it is deteriorating further. They're not able to control these tremors.
It needs good nutrition. We need to help in the absorption. Then provide some sort of exercises or physical therapy. So could be suggested. Then it would be helpful.
What will be the role of our medicine then?
As I mentioned, first the medicine should also help in absorption. Medicine should stop the progress of the disease initially. First and foremost, stop the progress and then help in the absorption or retaining the vitality. Obviously, nerve coordination is affected, but then the physical strength would be increased, and with practice and with increased mobility, the conductivity could also be improved. And homeopathic remedies obviously improve the conductivity of the nerve conductivity. Remedies like hypericum or any other active spicata sort of these, they help in bringing down this. Even Simsifuga helps. It
Okay.
depends how we try to individualize the person and what is his chronic state and what is the acute state. If it is clear, if we have to just see the tremor, we may not be able to help. We would be prescribing only those tremor remedies. But then, if you get into the detail of it, you can see the like the way I approach, which I couldn't present it as a case, is I go with these seven things: what, when, why, with what, how. It can be applied in an acute scenario as well as in a chronic scenario. When does it happen? Why does it happen? With what it happens? What is the cause? What is the time? All those things. If you can precisely pinpoint to that, obviously this train proceed. Even tremors, they are able to. People who were unable to hold things or eat without help started to eat by themselves until now.
Okay, that was helpful, sir. Thank you very much.
Yeah.
Thank you.
Is there anyone else who want to ask a question?
Yes, Dr. Rajesh, can you just have a look at the chat box? Dr. Shabrish has asked, what if the patient is already on other medication,
Good evening.
conventional,
How do we go about
for
treating the patient
ADHD?
if progressive is already on conventional medicine? Or already on conventional medicine, we can treat with for whatever the patient has come for. If in case they are already taking allopathic medication, still they are coming to you in the sense there is a set objective, right? You can set your own objective, or the patient comes with an expectation. Like it's a very imaginary situation. I cannot directly comment about it, but then we can focus on at least improving the quality of life first, and then if we are able to delve deep enough, I think probably it helps in both of them go complementary with each other. I would not say it is going to be complete reversal of everything, but then whatever desired changes were expected with the use of allopathy, if it is not happening, and if our medications could do, that's helpful. I don't think so they are going to hinder. If you feel there is a hindrance, start initially with whatever partial totality you have. It would bring about some sort of reaction, and then based upon it, retake the case and proceed further, and slowly try to taper those medications if you find it unnecessary. There are lots of supplements that are given in conventional medicine. I don't think so there is a need to stop those things. If at all, in the sense, medications for these things are usually synthetic ones. I don't think so. They don't come under the classification of, usually there are three types, right? Agonizing, antagonizing, or ligand sort of. That is not the case here. The most of the remedies prescribed here are facilitators. If in case as we accuse allopathy most of the times that it is damaging, I don't think so. In every case, it is damaging or producing side effects. So if you feel it's unnecessary after starting homeopathic treatment, you can stop those medications. If it is going hand in hand, you can obviously continue. That is my understanding.
Doctor, there is somebody on Facebook who has asked, how do you handle osteoarthritis?
Yeah, osteoarthritis.
Dr. Shripriya wants to know how you handle osteoarthritis.
Osteoarthritis depends upon how far the damage is. But most of the time, what happens is that patient usually comes even after surgery. Some of them they get the knee replacement and they come to us. In those cases, I don't think so. We are able to do too much or much. Only pain management can be aimed about in those patients who have gone for some sort of intervention. But otherwise, osteoarthritis in old people who have osteophyte formation also, even they have got improved. Like there was a patient recently who was unable to walk because both the back, there was this osteoporotic changes or arthritic changes in the back as well as in the knees. And just one remedy, I think, it was commonly indicated driver that helped him. Uh, just a common remedy also could help a person to bring back walking. He was actually going to, he was evacuating his bowels by standing, and then he was unable to sit or stand. There was trembling in his legs. So after a couple of doses, he was able to walk. That made him confident. So, like, pain management is the first and foremost thing that should be aimed in cases like that of osteoarthritis. Then we can go for long-term management, like uh, concentrating on the weight reduction by suggesting exercise or diet modifications. Also, remedies that could help in the remove the tendency of obesity, if in case that there is small absorption. The remedies could obviously help in the absorption of calcium or any nutrient that is. And of course, people that improve very well in osteoarthritis. People can manage their life without any deformity, that I can assure. Pain relief is 100%. I don't think so. There is a special need.
Doctor, there's another from Hattis.
Yeah, it is.
Yeah, she's got something in the chat box. Can you have a look at it?
Lupus erythematosus and degenerative diseases and explain how remedies are used, and thank you. I appreciate your time. Lupus again is like rheumatoid arthritis. It's affecting the Respiratory as well as the um, integumentary system as such, affecting the lungs, the connective tissues of the organs like spleen, liver, and all, and then obviously joints, even eye. So the progressive to say degeneration is there. But as far as what I have studied is that the people who had to face a lot of injustice and who tried to stand upon themselves to fight it, are those people who have more predisposition towards this rheumatic disease, be it systemic lupus erythematosus or be it rheumatoid arthritis. There is a lot of injustice that happens with them, but still they keep on fighting, fighting, fighting. And thus they, at one point of time, become like what to say, restless warrior, and there is a great bit of apathy. But also, these people have great sense of duty. The sense of duty is probably that predisposes them to this sort of this thing. So these are some of the pointers towards remedies that could be prescribed for the systemic lupus. I think most of the time the causation is these things: injustice, despite injustice being beautiful, or trying to fight back, trying to find a way. Uh, that's it. That in a sense, those who are like we don't want to give up. These are the people who get these complaints. The rigidity that comes because of their nature, rigid nature of things. People develop contractures of the joints, or there is deformity as such because that happens. So lots of thickening that happens because it's because of their own nature of being uh, in such a way, very rigid, exerting all the pressure, in the sense, exerting all the energy that they could to go about it. So I think that's how we just need to go. Other than that, if there are any acute manifestations, one has to look into those acute possibilities. Of course, in these diseases, rain affects, the cold weather affects, and these are the two things. Coldness in general, in fact, coldness of the people as such, people who are mean, who are cold, they affect them a lot. So these things, if we consider, I think there are pretty much several remedies that could bring back people to almost normalcy.
Does anybody else have anything to ask Dr. Rajesh? So if nobody has got anything to ask, I'd like to thank Dr. Rajesh for this wonderful webinar.
I hope it was not boring.
Oh, no, no, not at all. There were so many things that were interesting about how incidents in the youth can affect or can actually lay the foundation stone, if I use it
The
for
foundation
these.
habits.
Yeah, yeah. The foundation habits actually is something that we need to look at, which is an interesting insight into this kind of these kind of diseases.
I
So
just wanted to emphasize that there has to be balance in life, and if possible, maybe at that age, people don't know, but as physicians, we should be telling our patients that this is how it could lead, or in the sense, giving information to the patient is very vital for a homeopath. At least I feel, because it makes them understand, gives them an understanding about life as such, and giving these examples also help them so that they can relate to their near ones, those who are elder to them. And if they understand it, they obviously take precautions for themselves as well as for children. And they sort of develop that belief in it. Like if you could show what happens if for a person if he is in so and so if of so and so nature, going into so and so habits or predisposition, then how he could progress in a good way, in a bad way, and how it could lead to complaints. Then obviously anybody could relate. That's what I feel. That's how I have been giving explanation of life as such to the patient, and trying to show the picture of all the possibilities, good as well as whatever wrong could happen. That's why I also emphasized on reading. Too much of reading is also not. Since many people they invest so much into struggle or business or being so ambitious that they forget other things, which is also not good. There has to be a balance. And I think that way it is helpful. Sometimes there are cases, examples that we can give. Sometimes we have people around us to give, exemplify, and we can obviously relate all these symptoms of material and show it to people. So that was
So that was an interesting relationship that we can draw, and I hope everybody was able to go away with something that they learned today, and they can apply it in their day-to-day consultations, and hopefully will become a better homeopath. Thank you, Dr. Rajesh, once again, and we hope to see you more often in this
sure, sir. I think we
webinars.
have next one coming next month.
Yeah, we have one more coming.
I'll request the people if they have any other suggestions that if it was not that helpful, they can write to me on Facebook itself.
Right.
I'll try to improve next time.
Yeah. And if there's any other subject you'd like us to deal with, you can email us. Once the video is up on the website, I would request you to leave a note for Dr. Rajesh on how you like the webinar, which will go a long way in enthusing him to do more webinars for us.
I usually have not done much. Hopefully,
Okay.
if people like it, I will go try to do.
Definitely, Dr. Rajesh. Okay, Kalpana, the website is www.ilovehomeopathy.com. You can go to /webinars and you can see all the recorded webinars that we've done so far, maybe something close to 30 webinars we've done. So you can have a look. You can skip your Netflix for the month and maybe sit and watch webinars.
I don't think it's possible for everyone.
Yeah, we have to have a balance, doctor. Balance
Yeah,
Netflix and webinars.
yeah. Okay.
All right, then. Thank you very much, doctor, and
Yes,
we'll
thank you.
see you soon.
Thank you for
All right,
inviting.
everybody.
Thank you everyone for patiently listening.
Yes. Thank you, everybody, for coming. Bye bye.
Good night.